Namaste. Psychoanalysis and philosophy, essential and comprehensive knowledge. Knowledge is of different types, and one way to classify knowledge is to take recourse to the terms essential and comprehensive. It is really inviting to go deeper into this topic, especially in the context of psychoanalysis. So let us take this journey with our psychoanalysis consultant, Mr. Himanshu Vaidya. Namaste, Mr. Vaidya.
Namaste.
Mr. Vaidya, can we start with what are the different types of knowledge we have?
Knowledge can be classified in various ways. Let us take a few classifications with examples. We can classify knowledge into scientific knowledge and philosophical knowledge. Scientific knowledge is that knowledge which can be put to the test of science, and philosophical knowledge is that knowledge which cannot be put to the test of science. For example, how does the brain operate can be put to test on some points in neurology, and that will give us scientific knowledge. But why should the brain exist in the first place? That is a question that cannot be dealt with scientifically. So if we want to think over the problem, why should the brain exist in the first place? Why would nature have to create this entity called the brain in human beings? So these kind of questions are empirically not investigatable, if that is the word for it. So therefore we deal with this kind of questions in a philosophical way. So what is called in Indian spirituality, you can prove or disprove things only in the world of words. You can't prove or disprove this kind of things or discuss them in the laboratory. So this can be one classification, scientific knowledge versus philosophical knowledge. You can have a second classification, exact knowledge and inexact knowledge. So if we look at science per se, natural sciences, physics, chemistry, biology, mathematics, they have more exactness in them. At least physics and mathematics have it, if not biology. And if you compare them with economics, sociology or psychology, these are very inexact disciplines. So you can divide knowledge into exact knowledge and inexact knowledge, and the inexact knowledge will have all social sciences, humanities, arts, philosophy and everything else. You can also divide knowledge into empirical knowledge and non-empirical knowledge. For example, if you look at knowledge which you have in the area of allopathy, it is very empirical. But if you look at homeopathy, the knowledge is not empirical. We know it works, but we don't know how it works. So that is one more way of classifying knowledge. Knowledge can also be classified in a spiritual sense in terms of the world as we know it with our senses and the mind, and the world which is beyond. So that is termed in the Indian spiritual discourse as paravidya and aparavidya. So their knowledge is divided into two parts. Aparavidya is all the sciences, right, which are pertaining to this world, and aparavidya is pertaining to the other world, the world before our birth or after our birth, or those zones of the universe which are not accessible otherwise. So sciences arts, crafts, philosophy, all of them will fall in some parts of philosophy will fall under Paravidya, Aparavidya, and many of the parts of philosophy and spirituality will go into Aparavidya. So we have there the classification of knowledge. One more classification similarly is what we are talking about today, essential knowledge and comprehensive knowledge. Essential knowledge pertains to generic knowledge, which is knowledge of fundamental principles. And comprehensive knowledge refers to specific knowledge, knowledge of details of some phenomena. For example, if you heat water, it will boil at 100 degrees C. If you heat petrol, it will boil at some temperature. If you heat milk, it will boil at another temperature. So let us say water boils at X temperature, petrol boils at Y temperature, and milk boils at Z temperature. So this is comprehensive knowledge, that for water, the comprehensive knowledge is water boils at X degree, milk boils at Y degree, petrol boils at Z degree. This is comprehensive knowledge, specific to each particular phenomena. Usually what we call scientific knowledge. But from these three, you can deduce a principle that liquid boils when heated. So if you deduce this general principle from these three phenomena, that becomes essential knowledge. Comprehensive knowledge is seen and found in our activity, in the world. But the essential knowledge is derived, deduced. It is not seen in the laboratory. It is deduced from what is seen in the laboratory. So when you see again and again something in the laboratory, 5-7 different phenomena, and there's something common in the 5 phenomena, you deduce that principle. That principle is not seen in the physical world. It is our mental summary of 5 different phenomena. What is common to the 5? That generic distillation is what we refer to as the essential knowledge. So we can divide knowledge into two: the knowledge of generic principles, which we call essential knowledge, and the knowledge of particulars and specifics, which we call the comprehensive knowledge. Essential knowledge essentially is philosophical in nature. Comprehensive knowledge essentially is scientific in nature. And in between the two, you can always have something which you call philosophy of science, or in psychoanalysis, we call it metapsychology. So you will have comprehensive knowledge in psychoanalysis. You will have essential knowledge in psychoanalysis, which we call metapsychology. And if you become even more exact and more esoteric, you will go into philosophy of the mind. Because there is a confluence between metapsychology and the philosophy of the mind. Because both of them are dealing with essential knowledge. Not only essential knowledge, but definitely with essential knowledge to a great degree. And we have observed specific kind of knowledge by virtue of what we look at in the clinical room. So we have in psychoanalysis also comprehensive knowledge based upon what happens in the room. And when we have repeated experiences of that particular type and we deduce a general principle from there, it becomes essential knowledge.
So is it called theorizing or conceptualizing? Or that is different?
That includes both. Because we can be theorizing about specific knowledge also, comprehensive knowledge also, and we may be theorizing about the essential knowledge also. But we can demarcate them by saying essential knowledge is the knowledge of generic principles, whereas comprehensive knowledge is knowledge about particulars and specifics related to a phenomena. So we find both of them in psychoanalysis also.
How do these two terms, essential and comprehensive, fit in there in this whole thing of knowledge?
So In psychoanalysis, what we find is this. Let us take a few examples of essential knowledge and comprehensive knowledge in the context of psychoanalysis and see how our definitions fit into psychoanalysis. Take few examples of essential knowledge. If you look at the fundamentals of psychoanalysis, you will get the essential knowledge that we have in the area. Take 5 examples. Existence of unconscious, primacy of childhood, significance of dreams, revisiting the past, and making the unconscious conscious, and catharsis of pent-up emotions. Now, these 5 are fundamental principles of psychoanalysis. Now, these principles were deduced because of experience with hundreds and thousands of patients. That repeatedly you see in hypnosis, people have memories which are not accessible to the conscious mind. And when you see that again and again, you realize there is a part of the mind to which we don't have access in the waking state. And therefore the unconscious exists. You interpret dreams of 100 people and you realize when you interpret the dream, you get an access to the unconscious very fast. So you deduce a principle and you say dream analysis is a royal road to the unconscious. You start analyzing people and repeatedly you find the causes are in the childhood. So you put up a principle, primacy of the childhood. You realize that without revisiting the past, the present cannot be healed. So you create a principle, revisiting the past. You realize that unless you make the unconscious conscious and you through catharsis throughout the emotions, healing does not happen. So you put up a principle, making the unconscious conscious, catharsis of pent-up emotions. So this becomes essential knowledge of psychoanalysis. Now we go to the comprehensive part. If you put a question to Freud, what is the explanation for paranoia? He will give you a dynamic sequence. Repressed homosexuality, I love you, I hate you, I will kill you, you will kill me, therefore the paranoia. So this becomes specific knowledge, comprehensive knowledge, related to a particular problem. If you put it to Klein, what is the explanation for paranoia? She will say the split is open, there is a fear of attack of the bed rest. If you put up the a question of to Winnicott about why the problem exists, and he might come up with an answer. It is a question of the false self being in the front and the true self not being able to come out. If you ask Kohut for a problem in narcissism, and he will say early life frustration of mirroring, idealizing, or empathy has created this unhealthy self, a narcissistic self. If you ask to Devadu, he will say murderous and torturous rage and associated guilt and secondary anger is creating problems. So these are examples of comprehensive knowledge. Knowledge which is specific to a particular problem, to a particular phenomena. So we see both these things operating in psychoanalysis, essential knowledge and comprehensive knowledge. And we realize much of meta-psychology and fundamental principles of every school of psychoanalysis is essential knowledge. Whereas the pathogenesis that each school offers for every problem that we have at hand constitutes the set of comprehensive knowledge.
Immanuel Kant wrote the Critique of Pure Reason. So how does he deal with this in this writing of his?
That's an interesting thing, because Immanuel Kant did not use the words essential knowledge and comprehensive knowledge, but he used the word a different class of knowledge. So he was clear that there is a knowledge which is specific knowledge. You can create a booklet like a logbook which tells you temperature at which all the liquids boil. And you can have a list of 1000 liquids and what temperature they boil at. You can easily create a technical handbook of that type. That is comprehensive knowledge. Of course it is. It is very useful. Of course it is. But do you feel interested any time to read it unless you have to use it? Nobody would feel interested to read it. So Immanuel Kant put up this question that our mind is intrinsically hardwired to create and search for essential knowledge. Essential knowledge is not available in laboratory. It is deduced. This is deductive knowledge. This is not inductive knowledge. Comprehensive knowledge is inductive knowledge. You do an experiment, you do some action and find out what's happening, and you record it. Repeatedly, when you record it, the same way it comes, you realize there is some cause-effect relationship, and therefore this is the knowledge. So this is a very comprehensive knowledge creation is a process of induction. It's inductive knowledge. But essential knowledge is deduced as a meta summary of many inductive experiments. So Immanuel Kant put forward the notion that somehow we are not satisfied with comprehensive knowledge, no matter how big a heap of knowledge you have. You find actually boring, but we find very interesting deriving generic knowledge and talking about generic knowledge, the essential knowledge. So we are sort of hardwired for it to derive and search for essential knowledge from a heap of comprehensive knowledge. If you apply this to psychoanalysis, it will be like this. If you look at Gautam Buddha's noble truths, that is one of the most generic and essential forms of knowledge. That desire is the cause of suffering. It's a very essential form of knowledge. But if you go into specifics, there are 1000 desires and 1000 forms of suffering because of each desire. And the desire operates differently in the childhood, which psychoanalysis makes us understand in a much detailed way. The quest for an all good breast is also a desire, and the Oedipal desire is also a desire. And the desire for mirroring and idealization and empathy also is a desire. Desire for a good enough mother also is a desire. And desire for attachment also is a desire. But the life journey of all these desires is a very different process altogether. So just by saying that desire is the root of all problems, you can't solve anything. So it is true that desire is a root of all problems, but that does not allow you to solve anything. The summary is true, but in execution, the summary cannot operate. So the difficulty is to solve anything specific, we require scientific knowledge. If I want to prepare tea, I can't tell myself desire is the root of all problems. That doesn't solve my desire for having tea. It does not help me to make tea also. The process has to be known. If you have to perform surgery, you have to know how to do surgery. It's a science by itself. If you deduce general principles of surgery, that ultimately you are going to cut open, set right and put it back again, that essential knowledge is not enough. So what we talk about here is Kant leads to two things, the scientific knowledge and the essential knowledge. And he says that in operation, we need comprehensive knowledge, because all factories, science and technology, medicine, everything works on comprehensive knowledge. You specialize in a particular area only to get more comprehensive knowledge. But the human mind is not satisfied only with comprehensive knowledge. Even if it knows that in order to do anything in the world, in order to practice any profession, comprehensive knowledge is all that is needed. Otherwise, in generic terms, most of us are equal. So even though we know that comprehensive knowledge is what works in the world, what we base our professions upon, what is necessary to do anything, yet we have a special taste for essential knowledge, and particularly in the area of philosophy and spirituality. Because in spirituality and philosophy, we have very high value for essential knowledge. And not only do we value, but actually we discover it in ourselves afresh. So self-discovery of the same principle again still has its own value. So this is how Kant looks at it, and he says that you have various stages of knowledge. You have sensations, you have perceptions, you have conceptions, you have knowledge, and you have wisdom. And as you move from sensations to wisdom, knowledge becomes more contextual and slowly and gradually more essential. So when we talk of wisdom, we are talking by and large about essential knowledge, not comprehensive knowledge. So Kant deals with it, and these words, essential knowledge and comprehensive knowledge, they are used by Sri Aurobindo actually. They are not words used by Immanuel Kant. So if you read Sri Aurobindo, he uses these words, essential knowledge and comprehensive knowledge, and the Sanskrit for them is Gyan and Vigyan. Gyan is essential knowledge and Vigyan is comprehensive knowledge. So Vigyan is Vishesh Gyan, comprehensive knowledge. And in spiritual tradition also, we see this, that certain disciplines, for example, Patanjali's yoga system, Yoga Sutras, they are essential knowledge. But if you go into Tantra, they have huge volumes of specific knowledge, comprehensive knowledge. Knowledge about each chakra, about how the nadis operate, and so on. So we look at the essential and comprehensive knowledge as talked about by Kant, as talked about by Indian spirituality, different schools.
You just brought it up, this yoga and tantra. So can we relate our discussion to dating of yoga and tantra schools in historical terms?
Yes, we can. This question is important because there is a long-standing controversy. There is a long-standing controversy about which school is ancient. Did yogic schools come first or did tantric schools come first? And there, one of the ways we can settle the debates, or we can think about this debate, is to think in terms of essential knowledge and comprehensive knowledge. Essential knowledge is easy to generate. Comprehensive knowledge takes generations to generate. Essential knowledge you can generate just by sitting somewhere, meditating, thinking about life, thinking about yourself, thinking about nature, and so on. So if you want to say that the world is created out of 5 basic elementals, that's easy to create an essential system. But if you want to say how each of them operates in the molecule of hydrogen, that's a difficult question to answer. So essential knowledge is easy to generate. Comprehensive knowledge is very difficult to generate. Much of the comprehensive knowledge cannot be generated unless you are accompanied by certain advances in science and instruments. Because a large part of comprehensive knowledge is generated only with the help of instruments. And there you build upon each other generation after generation. Some generation invented microscope, electron microscope, and today therefore we are where we are. Many things cannot be done without electron microscope. So comprehensive knowledge requires the work of generations, certain inventions and certain instruments to be carried out. But essential knowledge does not require that kind of thing. So when we look at the nature of yoga and tantra, yoga is more into essential knowledge. Tantra is more into specific comprehensive knowledge. On that basis, it appears that yoga would have appeared first and then tantra would have appeared. Because it's easy and doable for somebody to create the essential knowledge, but to go into the niceties of tantra, particularly I am talking about that part of tantra which deals with things outside of the body, where you just can't sit alone and go into specifics of the body, but you are talking about things outside of the body. You are talking about certain herbal preparations, you are talking about certain use of certain mandalas and so on. So these are areas which tell us that if we take the inquiry through essential and comprehensive knowledge, yoga seems to be something that would predate the advent of tantra.
How does psychoanalysis engage with these two terms?
Psychoanalysis, you have both these types of knowledge, essential knowledge and comprehensive knowledge. Take 5 examples of each. If you take essential knowledge, right? Take examples of the fundamental principles of psychoanalysis. I think we just referred to it. The existence of unconscious, the significance of childhood, significance of dreams, making the unconscious idea conscious, cathartic of pent-up emotions, revisit to the past. These are essential knowledge that is involved. But let us come to the specific. The frame that you create, the frame of psychoanalysis, the technique, is an example of comprehensive knowledge. Pathogenesis, for example, pathogenesis of any particular problem. Say, pathogenesis related to paranoia, pathogenesis related to depression, related to generalized anxiety, related to personality disorder, related to alcoholism. Explanations for each of them are an example of comprehensive knowledge. Now this differs. When you talk about essential knowledge, there is more consensus among schools of psychoanalysis. But when you talk about comprehensive knowledge, the differences are more. So when you talk about pathogenesis or how to do therapy, take between Freud and Jung, there would be a consensus on essential knowledge. Both would agree on the existence of unconscious, significance of childhood, significance of dreams, making the unconscious conscious, revisiting the childhood. Both would agree. But when it comes to the specifics, comprehensive knowledge, how many sessions to have per week? Should it be on the couch or face to face? Should the focus be more on sexuality or in general? How do you interpret a dream? Do you look at something called collective unconscious or you just look at personal experience? These would be examples of comprehensive knowledge. So across schools in psychoanalysis, there would be a consensus on essential knowledge, differences on comprehensive knowledge. And comprehensive knowledge keeps evolving because you keep doing researches. For example, if you want to study how does paranoia operate, let us say in age of more than 60 with people having diabetes? And is there any difference between the type of paranoia they experience and somebody who is above 60 without diabetes? And is there any difference between the way these two groups experience versus somebody in the age group of 25 to 30 completely healthy? Now, these are the questions we can't answer without taking adequate sample of the three groups. So these are the type of specific researches which constitute the comprehensive knowledge. So this is the way we look at in psychoanalysis, essential and comprehensive knowledge. Much of essential knowledge we call metapsychology.
Does this knowledge help us in theory and tool creation in psychoanalysis?
It can, but it has not till now, because people never looked at it this way. If you look at essential knowledge of all the schools, if you put them on a chart and then you try to mix and match and try to create an integrated theory, whatever extent you can, that would be using essential knowledge to create a meta theory, which can be integration, synthesis, partly or fully of existing theories. That kind of enterprise most people find too ambitious. There are too many differences. And unless you create a model of the mind where you start from elementals in terms of which all other schools can be explained, unless you go through that route, you really find it very difficult to create something purposeful out of essential knowledge of all the schools. And that very few people have tried. I have tried in my own model of the mind called HIT, but very few people have tried otherwise. That is one. So in theory development, it can be done, but it is not being done. Take for example, even in case of comprehensive knowledge, for example, let us say we take only one sickness, say depression, and we try to find out how each school of psychoanalysis is explaining depression. So Freud would say it is the loss of ambivalently cathected narcissistic object. Klein would say it is internalization of a dead mother or attack of the bad breast. Winnicott would say it is the absence of good enough mothering and the sadness arising out of it. Kohut would say it is a loss of objects. Each of them has an explanation. The point is, can we put them together to see in which group of people which works and why is it so? That would allow us to put comprehensive knowledge on a single point of different schools together and arrive at a far more accurate and integrating framework even in the area of comprehensive knowledge, and from there certain insights may lead us to more essential knowledge. That unfortunately very few people have tried to do. And this again goes into the problem I've said, very few people have expertise in so many schools, and the enterprise of creating a meta theory is too daunting for most. So that is one part. With regard to tools, psychoanalysis always has been a tool deficient area, because people are just too lost in theory, in themselves, and in anxieties of having or not having patience. Very few people actually have the creativity and the energy and the courage to develop tools, because the primary principle upheld by Freud was reflecting, not acting. So Freud never used any kind of self-work between two sessions done by the patient himself. So unlike CBT, which uses self-work between two sessions, psychoanalysis never used it, and therefore never developed really any tools for either self-use or administration by somebody. So it's a very tool deficient area, and I believe this is an area we have to work upon, develop tools which can be administered by the patient to himself, or tools which can be administered by the therapist to the patient or by a third person to the patient. But tools are necessary, and this tool deficiency also can be partly met if we put together the essential and comprehensive knowledge. For example, let us say we talk about the split, comprehensive knowledge, the split, and there is a patient in whom we realize this, the split is open. Now what do? The analysis is very clear that the split is open and we want it to be closed. Now how do you close it? Now one way is the classical way of interpretation, discussion, and so on. Putting the opposites together, make the person see in one glance both of them and integrate them, and so on. But can you use any other technique? Maybe writing a story in a particular way where two opposite characters are created and then a third character is created where both are put together. Or maybe there are some toys where you use one toy, the other toy, put them together and create a third one. It can be done using computer games, virtual reality. So this entire tool creation to address the psychoanalytic problem is something we have just not tried. And this year, I propose to give much of my time to tool creation.
We come to our last question. Is there a scope for essential and comprehensive knowledge of psychoanalysis and spirituality to enrich and complete each other?
It's potential, but they are so apart and so hostile to each other that nothing comes out of it. Take examples. Let me give 5 examples of essential knowledge from psychoanalysis which spirituality can use, and 5 examples of comprehensive knowledge from spirituality which can be used by psychoanalysis. And this is only a tip of the iceberg. You can dig deeper and find more. Take essential principles of psychoanalysis. Existence of unconscious. Essential knowledge from psychoanalysis. Take comprehensive knowledge from psychoanalysis, or should I take only essential? Let us say I take only essential. The existence of unconscious, significance of dreams, primacy of childhood, the dual forces of merger and separation, and the quest of omnipotence. If you take these 5 elements as essential knowledge elements and give it to any person in spirituality, any guru, he can make immensely good use of it. Because in any aspirant, sadhak, these 5 elements always will be missing. There will be problems related to these 5 elements. There is no way you can bypass them in your process of self-development. So when you go to a guru, the omnipotence is going to play out, the Oedipus is going to play out, the split is going to play out, the significance of dream is going to play out, transference and counter-transference is going to play out. There's no way you can escape it. So if those on the spiritual path know about it, many of the problems which are unnecessarily created and many problems which linger on and can be quickly solved with knowledge, they can be done far more swiftly, easily, without suffering and quickly. So it accelerates the spiritual process, makes it smoother. So it enhances the efficacy of everyone involved, enhances the efficacy of the whole enterprise itself. Now look at what you can put from spirituality into psychoanalysis. Take for example the whole comprehensive knowledge related to chakras, the essential knowledge related to observation and overcoming something by observation, comprehensive knowledge related to comprehensive knowledge related to the use of meditative techniques to clear up each of the chakras, comprehensive knowledge related to use of visualization and herbal intakes, comprehensive knowledge related to use of various meditative practices, comprehensive knowledge related to the use of various pranayama techniques and yoga techniques. They can easily be brought to psychoanalysis and be used for giving relief to the patients. Of course, you have to do research before you do that, but we have proven tools, proven techniques in spirituality, proven not by our scientific standards, but in tradition, by standards which were standards in tradition. And of course, to comply to regulatory requirements, we can retest them to find out if it works or not, and then bring them, if they work, into psychoanalysis. So this way we can put essential knowledge of one or comprehensive knowledge of one into the other, and both of them have essential knowledge, both of them have comprehensive knowledge, and both these sets are very enriching for the other. So if you look at a confluence of the two, both will enrich each other in both these categories of knowledge.
This was truly a very enriching journey, Mr. Vaidya. Thank you so much. Do write to us at hvindia@gmail.com. Namaste.
Namaste.